Hello and welcome once again to The Blueprint. This is Canada's Conservative Podcast. I'm your host, Jamie Schmale, Member of Parliament for Haliburton, Kawartha Lakes, Brock, with new content for you every single Tuesday, 1:30 p.m. Eastern Time. Don't forget to like, comment, subscribe, and share this program. We'll have new content for you every single Tuesday, even throughout the summer. You can download it on platforms like CastBox, iTunes, Google Play, and Spotify. You name it, it is out there. On today's show, we are talking about the doctor shortage that has ravaged pretty much every part of this country. It seems to be getting worse. Nurses too, pretty much any healthcare professional. So to talk about that and much, much more, we bring on Dr. Stephen Ellis, the Member of Parliament for Cumberland, Colchester, in the beautiful province of Nova Scotia, also the health critic. Thanks for coming on.
Well, thanks very much for having me, Jamie. It's always a pleasure to be here. You know what? It always gets me. You say those lines, they roll off your tongue like liquid gold. So it's
well,
amazing.
You inspire me to do my job, and I just try to live at the same level as Doc Ellis. So the healthcare shortage. Absolutely terrible. I don't think there's one part of the country you can go to where things seem fine. It's getting worse. The Liberals have brought in new changes to the capital gains, which many doctors relied on a corporate structure, if you will, to save for their retirement, etc. Maybe just lay down the picture of what we're dealing with, what the government has been doing that has been just pushing physicians either out of the trade altogether or out of the country.
It's a huge problem, as you mentioned, Jamie. I mean, we're talking almost 7 million Canadians right now without access to primary care. And, as your viewers out there know very clearly, that having a family doctor is how you get into the system, so to speak, in Canada. You can't have a test or a referral without access to primary care. And that creates huge backlogs in the emergency room. People have no choice. They can't access a family doctor or a nurse practitioner, and so therefore they are forced to go to the emergency room for tests, investigations, referrals, etc. With an expanded scope of practice for pharmacists, you can get your medications refilled by times, although probably not perpetually, but certainly there's some things there that are helpful, expanding other practitioners' scope of practice. But when we look at it now to understand that there is this already existing huge problem, now what the government has done, as you mentioned, many physicians in this country are still working what we call in the business fee for service, so you get paid on a per patient basis. And what the government did, it's probably around 25 years ago now, is they allowed physicians the ability to incorporate, as you said. And the messaging at the time was that was in exchange for the fact that the fees that physicians were being paid were not increasing very much because of government austerity at the time. So they said, we'll give you this opportunity then to save for your retirement in a different way.
Right.
So that was adopted by many physicians, and certainly that continues on to this day. That ability is still there. And in physicians, for instance, such as myself, I practiced medicine for 26 years. Now I'm here. But all of my savings are saved in a corporate vehicle, of course, you might say. And those will be subjected to this capital gains increase, which causes much consternation. For other physicians who have retired, they're not going to go back to work. So where does that leave them with this change that they were promised would help them retire? And now the government is increasing the tax on that. This is a major tax hike.
Of course, as we know, in any government that gets too big or the spending gets too far out of control, they look for other ways to raise revenue, right? Taxing, borrowing, printing, combination thereof can debauch the economy or currency at the same time. The government's just broke. They're not short of cash, right? So they
Right.
think of doctors as people who have stuff, and I'm not saying they're well paid, but you kind of want them to be well paid because they do an amazing job and they have to be super smart and years and decades of training and all that. But at the same time, they were, as you mentioned, they were told to do this and you can save for your retirement, because otherwise there really isn't a vehicle available to these physicians.
No. There's a whole host of things there that are the problem, right? I would suggest that this government is attacking anybody who chooses to be successful.
Yes, who has, in their mind, stuff.
Right.
Right.
You see it in other small businesses as well. I mean, this country is built on the back of small business people who take that risk. often with much of their own money, usually in their businesses. They originally invest more than 50% of their own income, of their own savings in that business, and then it grows. And so should they be penalized because they took that risk, or should they be rewarded? Because oftentimes they will also employ a multitude of staff helping to run their business. Then they will have other investments. They often, will buy buildings, the building that their business is in. So I don't understand why this NDP Liberal coalition wants to punish small business owners. It makes no sense to me, because that's how our economy runs, and we want people to take risks in an appropriate fashion, of course.
Yes.
And we want them to be successful, and that is also, again, them paying their taxes is what allows the economy to continue to run. So when we apply this to a healthcare model, it's the Canadian Medical Association, the Ontario Medical Association has been very clear that this will negatively impact doctors wanting to stay or even go to medical school. And that, we've heard, certainly people have reached out to me and said, I'm not staying in this country anymore.
And it's important to recognize, too, I know we're focusing more on healthcare because the doctor shortage is real and getting worse, and this government seems to have no plan to fix it. Farmers are being hit with that, small business owners, right? There's risk
Absolutely.
and reward, right? If a farmer decides they want to pick up, a couple 100,000 more acres to do their business, and they can, with the price of cattle drops or whatever, you do take that risk. But hopefully the good times are ahead, and beef prices or crops, whatever it is, gets better, and you're able to recoup some of your loss and then plan for the future, right? And it as you said, it goes beyond the healthcare field. But when you put these barriers in place, you push down those that are trying to not only make a better life for themselves, but also we're richer as a community if we have more doctors and more farmers, right? It's more businesses.
Yeah, and I think that's really the underlying issue here, is to say that we want people, as I said, to take a risk and say, hey, my idea is a good idea. I want to help build my community. Maybe, as I said, maybe they buy an apartment building to help with the housing crisis that we have going on. Should those people be penalized for that? And perhaps, in the case of physicians, should you be able to change the rules partway through the game? And I guess I said physicians, but realistically affects all small business owners the same way. And one of the messages that I also think is incredibly important is they would suggest that the NDP Liberal coalition would suggest that it's not many Canadians, and we know that's not true. Go around your own community and see how many small businesses there are.
Yep.
So I think that's incredibly important. And in the changes that they've made, it's on the first dollar earned inside a small business. They talk about an exemption, et cetera, but with the structure that they've done, it's not that. It's the first dollar that you earn, and every dollar will be taxed that way. So it's a huge negative for folks who want to, as I said, take risks, kind of control their own destiny, and make their own way in this world. And those are the people that we need to support, in my
Exactly.
mind.
Absolutely.
Who want to do things and create things, and in the case of healthcare providers, they want to help look after people and be a good resource. It's interesting when you look at some of the other statistics around this. By 2028, 2030, the statistics would say we are going to be 44,000 doctors short in this country. When we graduate, somewhere around 4,000 to 5,000 every year. It's an impossibility to make up that number. So anything that we could do to encourage healthcare providers to stay in this country would be making sense. The other group that I talked to just yesterday, in fact, again, were dentists who also have small businesses. And in many communities right now, there are access problems with getting a dentist. And they echoed these comments as well to say, you know what, if we're going to be penalized for making our own way, many of them will buy another dental practice, or in the case of dentists, they often have property holdings as well. They say, well, why would we keep doing this?
Yeah.
So they have, significant concerns over this, of how it's going to affect the workforce as it applies to dentists as well. We can't be a country without healthcare. But it seems as though,
Well, they'll have another government program to fix it.
yeah, well, it's kind of shocking because, as we've taken to saying, they are creating problems,
Yes.
and then they're creating programs to fix the problems that they created, which
Never actually fix the actual problem. And it just goes on, and they need more money and resources to power those programs that they created. It's a very vicious cycle. You were in committee. Let's cue up Cut One. You were in committee not long ago, facing the health minister, and it's always fun to watch you two go back and forth. Mark Hollins is the health minister. I think you had him on the ropes when you were talking about the implementation of the capital gains, and did they actually look at the unintended consequences, which is fewer doctors in a healthcare crisis? So let's play Cut One.
Did your government complete an analysis on the tax hikes before implementing the change?
So asking those who are making more than $250,000 from capital gains.
No, that's not what I asked you. I said,
I don't agree. Look, I'm not here to play your bizarre game. I'm here to try to answer questions rooted in reality. If you want to issue a press release with your thoughts, I welcome it.
If you think the Canadians not having a physician is a game,
then
you're in the wrong job.
I think that
you are in the wrong job.
I think cutting dental care, cutting pharmacare, cuts to health care. So I guess the
question is, Minister,
those are the things that are menacing our healthcare system. Asking for a more equitable tax system.
Are you really going to just never answer any questions? Is that your plan?
Mark Hollins is a terrible minister. He is the absolute worst. And there's a lot of bad ministers in that caucus.
Well, he's certainly the king of word salad.
Yeah.
He always says a lot of words. We often talk about word count. I would be interested to see his word count. But the substance is not there. That's the sad part for Canadians. When you look at this, as you mentioned, if you're going to implement a change, you would like to know what the consequence of that change is. I think all they were looking at is the reported $7 billion that they were hoping to raise.
Yes. And I think it was a talking point for them too, right?
Absolutely.
Look at us, we're doing something.
Right. But to peg, physicians as being rich, physicians are paid well, generally speaking. Everybody knows that, but as you said, how do you choose that compensation? If you go to school, you become educated, you have a very significant responsibility. Then the question is how should you be compensated?
Well, it's also supply and demand, right? We only have so many people that can be doctors, right? There's only so many people can be doctors, right? So we need doctors, so it's supply and demand. And it's same thing with skilled tradespeople.
Right.
They're getting paid a lot of money because we don't have a lot of them right now, right? And not everyone can be a tradesperson.
Right. And there's a huge demand, right? As you mentioned, with that creativity and the ability to make something often out of nothing, then wow, that's amazing. And I think people recognize that in our society and say, hey, yeah, I'm willing to pay for that.
Yeah.
And so it makes sense. So, I don't hear many people out there saying that doctors are paid too much. I
don't really hear that either.
Probably some of them are.
Well,
but that being said, there are outliers in every profession.
Yeah, we want to get more, right? Abundance equals peace. We got a graphic here just showing the doctor shortage. That's a staggering number when we have a population of about 40 million. We have I don't know if you want to talk. We're almost out of time, but I don't know if you want to talk about maybe the graphic itself or the Blue Seal program that we're talking about, or anything else.
Yeah, so I think the Blue Seal program is directly related to the graphic. If you think about it, that 1 in 4 Canadians will not have access to a physician. It's absolutely huge. It's staggering. There's no other superlative I could think of. So part of the idea that we have is related to how can we, as a country, understand when people are trained elsewhere and they have experience elsewhere in the world, how can we quickly get them into our Canadian system? And that's something that we have announced a long time ago. And right now we continue to work with regulators to say that this has to be a reality when we form government, and how exactly the nuts and bolts of how exactly we're going to do that. It's definitely doable, and it's something that we can make come to fruition very easily, I think. I think the other thing that we need to look at is historically, 30 years ago, I know that's a lifetime for many people, but my class in family medicine was the first class to be required to do 2 years of training after medical school to be a family physician. Historically, it was 1 year. And that's another challenge that I presented to regulators to say, can we reduce this training time burden closer to 1 year than to 2? We would have significantly more domestically grown family physicians then as well. So that's something we are pursuing. So we understand that this is a problem. If you can't get seen, you can't get care.
That's true, exactly. We're pretty much out of time. Guests get the last word. The floor is yours.
You know, we talk about this fantastic healthcare system that we have, and we do, but if people can't access it, it's not fantastic for them. This needs to change. It's one of the things that, as Canadians, we're very proud of. So we need a Conservative government to make Canadians proud of their healthcare system once again.
Couldn't agree with you more. Dr. Stephen Ellis, Member of Parliament for Cumberland, Colchester, also the critic for health. Appreciate your time. Appreciate yours as well. Don't forget, all summer long, you can like, comment, subscribe, and share this program. Your friends can download it too on platforms like CastBox, iTunes, Google Play, and Spotify. New content every single Tuesday, 1:30 p.m. Eastern Time. Until next week, remember, low taxes, less government, more freedom. That's the blueprint.